started a blog back in 2006 when I was CEO of Beth Israel Deaconess Medical Center. And I started it mainly because I thought I had a really interesting job and that people might like to read about stuff I was learning about as I was running the hospital. So I actually called the blog Running a Hospital and covered stories of things going on in the hospital, but also policy issues and the like. Over time, that evolved. The blog evolved into a much broader forum for transparency of clinical outcomes and things like that. As far as I know, I was the only one who was putting up clinical outcomes about my hospital, again, in real time. I think old data is useless in terms of process improvement. To me, what's useful is to give people information in real time that reflects how your organization is doing. In the parlance of lean, to give people a visual cue as to how things are going so that they can constantly strive to improve and to hold themselves accountable to a high standard of care. I also used it to praise the staff and to tell their stories, whether it was lean, rapid improvement events or staff members going to Haiti after the earthquake or whatever it was, human interest kinds of things that people read and felt good about. In a way, I was doing something in parallel to the IHI Open School, where the Open School has forums and discussions about particular cases. I was offering a similar parallel view of many of those same issues, but from the point of view of the executive suite of a major teaching hospital. This movement into transparency, I have to tell you, was kind of inadvertent. Our folks at BIDMC were involved in a very good program to to eliminate central line infections in our hospital. And I was following that. The clinical folks were doing an excellent job, and I was really proud of what they were doing. So I wrote a piece on the blog about what they were doing, and I posted the infection rates for our hospital month by month in real time on the blog. What I discovered was that this was pretty unusual, that people usually do not post real-time clinical outcomes on the web for the world to see. The reaction in our hospital was very positive. First, people were really proud of the fact that I was proud of them, which was nice. The second thing is people were talking about this and saying, if our numbers are going to be there for the world to see, maybe we should try even harder to do well. And so I like to joke that I invented transparency as a management tool. I really didn't, but I inadvertently fell into that. Later, the hospital as a whole went with the support of our board of directors, used the corporate website, the internet website, to post clinical outcomes more specifically about reducing harm in the hospital, listing every quarter the number of cases of harm to patients and the kinds of harm, so that once again we could hold ourselves accountable to the standard of care we say we believed in. A patient woke up one morning from orthopedic surgery, looked down at her ankle and said, "Why is the bandage on my right foot instead of my left foot?" And it was at that moment that the surgeon realized he had operated on the wrong ankle on this patient. And while a certain amount of that was his fault for not properly following a timeout, it turned out there were systemic problems in the hospital that all contributed to this result. When we talked about the case with our chiefs and did a case review, we all decided that it was important to tell everybody in our hospital about this case so that we could all learn from it. So our chiefs voted unanimously to post this story in an email to the staff. I also decided, based on that I would post it on the blog because I felt there were lessons for other hospitals to learn from this as well. And that turned out to be one of the more useful aspects of writing this blog. Not only was it educational and helpful to our own staff, But pretty soon I noticed that people from hospitals all around the world were reading about our experiences and learning from them.